Hi. So in this lecture, we are going to talk about alcohols, and I'll be discussing with you the important points which are important for you to know and to expected out of you to know about this particular chapter. So let's get started. And alcohols, we are mainly concerned with three types of alcohols. The first one is ethanol or ethyl alcohol, methanol or methyl alcohol, and then we have ethylene glycol. Right. Now ethanol, it is the constituent for all the alcoholic beverages. So it is meant for consumption. So इसकी consumption हो सकती है. But methanol is a solvent and it is just added to ethanol to when we want to adulterate it, हम इसको we want to make it not so fit for drinking. And if you heard, in like so many times in the news we hear ki many people, like poor people especially, they went to a shop to buy liquor, and they were, after drinking the liquor, they were hospitalized. Purest liquor, adulterated liquor, because of side effects. तो क्यों होता है उसमें मीथनॉल, देसी शराब जिसको कहते हैं, उसमें मीथनॉल ऐड कर देते हैं, और दैट मीथनॉल इज टॉक्सिक फॉर द बॉडी. The third one is ethylene glycol, and this is actually again a solvent and an antifreeze. And this is called as toxic alcohol, which is absolutely not fit for drinking. And in case it is consumed, it will lead to a lot of side effects. It will lead to metabolic acidosis in the body, and that it's a dangerous thing. Now, let's see how are these three alcohols metabolized in the body. See, the enzymes required for the metabolism of all three remain the same. एक अल्कोहल डिहाइड्रोजनेज है और एल्डिहाइड डिहाइड्रोजनेज, ये सेम रहते हैं. बट जो मेटाबोलाइट्स बनेंगे, कंपाउंड्स बनेंगे, दे आर डिफरेंट, एंड दे कैन बी वेरी टॉक्सिक और माइल्ड टॉक्सिक और वेरी टॉक्सिक. राइट. सो लेट्स स्टार्ट फर्स्ट विद द इथेनॉल. So ethanol से क्या होता है? It gets acted upon by, metabolized by alcohol dehydrogenase, and there is formation of formaldehyde. This gets acted upon by aldehyde dehydrogenase, and it leads to formation of acetic acid. Now, when we, a person consumes ethanol, now the side effects mostly agar hote bhi hain because of accumulation of formaldehyde. If there is, too much alcohol being consumed and this aldehyde dehydrogenase, the enzyme gets saturated and it is no longer converting formaldehyde into acetic acid. So the levels of formaldehyde are going to rise, and they give to a lot of side effects like nausea, vomiting, diarrhea, headache, dizziness, all those unpleasant things, they occur because of formaldehyde. Now, methanol, it also gets acted upon by alcohol dehydrogenase, and here it is acetaldehyde, not formaldehyde. I'm so sorry for this. This is acetaldehyde, right? So this is the side effects. Now, methanol gets converted to formaldehyde. And this formaldehyde is very toxic for the body. It gets further converted into formic acid. Formic acid. So, चाहे formaldehyde है, चाहे formic acid है, both are toxic for the body. And the levels, when they go high, they can lead to ocular toxicity. Eyes के लिए they are very toxic. Renal के लिए, kidneys के लिए, eyes के लिए, both of them lead to ocular toxicity. And formic acid, definitely acid, it leads to accumulation in the body and leads to acidosis. Then we have ethylene glycol. See, now ethylene glycol as such is, I told you, it is a no-no. We don't have to use ethylene glycol at all for consumption. But yes, by accident or somebody consumes this, then it is very toxic again. And this leads to formation of glycol aldehyde. और फिर ये aldehyde dehydrogenase will act upon this, leads to formation of oxalic acid. So oxalic acid, agar there's poisoning because of ethyl alcohol, oxalic acid will accumulate. It can block the kidneys and leads to kidney stones and renal failure. It can lead to that. It's very, very life threatening हो सकता है इसका, ठीक है. So all these are the metabolic products. So whether it is ethanol, methanol, ethylene glycol. So acetaldehyde causes certain side effects, but formaldehyde and glycolaldehyde, they're very, very toxic for the body, right? So these are the metabolic products. Now let's come to the intoxications. What are problems with alcohol intoxication? Obviously this will be discussing in context to ethanol, because हम बाकी तो ले ही नहीं रहे हैं. We are not supposed to take it. Only alcohol जो ethanol है वो ही is permitted for consumption, ठीक है. So acute alcohol intoxication means suddenly the patient has taken a lot of amount of alcohol in the body, and what level के बाद there's that leads to toxic effects. About there is 500 milligrams per 10 ml of blood. That is very, it's like more than 500 milligrams of alcohol plus over 10 ml of the blood or plasma, rather. That is very, very toxic for the body. So how would you treat it? Definitely you are going to do some gastric lavage, ठीक है. Then what would you do? You would try to give thiamine, vitamin B1. एकदम से deficiency होती है इसकी. Magnesium, hypomagnesemia होता है, so you can give magnesium sulfate, and magnesium salts can be given to such patients of alcohol and intoxication. And definitely you have to do symptomatic management. In case there is dehydration, you will give rehydration by fluids. If there's hypoglycemia, you will give glucose in case of decrease in the blood sugar, ठीक है. So this would be the best possible thing for alcohol intoxication, acute alcohol intoxication. The second condition is when the patient has been consuming alcohol since a long time. So it is not intoxication. What happens to that patient is he becomes dependent on alcohol, and that's called as alcohol dependence. And dependence can be simply psychological, for well-being, psychological well-being के लिए लेता है. And if it's really more serious, it is even physical. So even if he tries to stop consuming alcohol, he is going to have a lot of physical signs and symptoms, and that's not good. So because to avoid those physical signs and symptoms, he's again going to consume alcohol. So he has become dependent of alcohol, and psychological or physical, ठीक है. So for treatment of such cases, we require a lot more intensive therapy, as it would be just for acute alcohol intoxication. So first and foremost क्या करेंगे, हम patient को detoxify करेंगे. तो जो भी alcohol है हम चाहते हैं body से हट जाए. उसके बाद हम supportive therapy देंगे to decrease craving. अगर craving नहीं होगी, he will not consume alcohol. So decrease craving, or we call it as support therapy. And then the third would be rehabilitation. It is very important. It is like the psychotherapy. He can go into groups and where they discuss and they try to help each other out. So that is rehabilitation by psychotherapy. Let's come to what happens or what drugs do we give for detoxification. See, the best thing possible is that if he is willing, the patient needs to stop drinking alcohol. So withdraw from alcohol completely. Then, alcohol, these patients have vitamin deficiency, especially the B group deficiency. So give him vitamin B, especially thiamine, vitamin B supplements देंगे. Then substitute अब alcohol अब नहीं दे रहे हैं, तो what you do, you substitute with long acting benzodiazepines. Long acting benzodiazepines like diazepam and chlordiazepoxide. So इससे क्या होगा, because they are central nervous system depressants, they are going to decrease anxiety in these patients. So they will be decreasing the anxiety, and they will be decreasing the, because patient might get agitated because he's trying to withdraw, symptoms are there. So agitation, and even it can decrease the propensity to cause seizures. The withdrawal reaction जो seizure cause करता है वो भी कम रहता है. So let's say by some reason some patients have have a COPD or respiratory issue, and जिसकी वजह से हम benzodiazepines नहीं दे पाते because they can further depress respiration. What you do, you have a substitute which is carbamazepine. It's an anti-epileptic. Carbamazepine. ठीक है? It will also lead to decrease in the seizures. You can even give this as such, right? Then what else can you do in such cases? Because there is sympathetic overactivity when a person tries to leave this thing. So decrease in the sympathetic activity. तो हम कैसे decrease करेंगे? You can give beta blockers. ठीक है? Because we are concerned with the heart, tachycardia, we can give selective beta blockers, beta 1 blockers and all. And you can give clonidine, which is going to decrease the release of the sympathetic neurotransmitters from the central nervous system. So they are going to decrease sympathetic activity. तो उससे क्या होगा? जो sympathetic stimulation है, जैसे tremors है, sweating है, all those things, they are going to be the tremors basically, tachycardia, because that can lead to heart issues. So all those things, they can be relaxed, they can be relieved because of such things. So you have detoxified the patient. ठीक है? पेशेंट को withdraw भी कर दिया अल्कोहल से, उसको धीरे धीरे हम चाहते हैं कि वो छोड़ भी रहा है. बट सेकेंड थिंग आती है कि अब उसको क्रेविंग भी नहीं होनी चाहिए, बिकॉज क्रेविंग रहेगी तो कभी ना कभी he'll go back to alcohol. So how to decrease craving, and you have to do it for a long period of time. So to decrease craving, we give certain drugs which are supposedly helpful in decreasing it, because craving can be because of a lot of neurotransmitters involved. Dopamine है, sometimes GABA है, ठीक है, and increase in the glutamate and GABA आपस में they have some role to play. So there are so many things involved, and it has been seen, we have tried and tested various drugs, and these drugs have been found to be effective in decreasing the craving. The first drug which is effective in decreasing craving is naltrexone, which is a opioid antagonist. Oral. Okay, this is orally given, naltrexone. So their role is basically in decreasing the craving. That's very important for alcohol dependence. That's why they are very good for alcohol dependence, apart from an opioid dependence. Then we can give an NMDA antagonist, because glutamate is supposed to have a role in craving. So NMDA antagonist, which is acamprosate, that has been found to decrease craving. Number 3 is disulfiram. Disulfiram, it is given because it inhibits the enzyme aldehyde dehydrogenase. Okay? So if I see here in this diagram, it will inhibit the enzyme, this one, aldehyde dehydrogenase. Okay? This enzyme is inhibited. So when this enzyme is inhibited, we're talking about ethanol. So obviously acetaldehyde won't be converted into acetic acid. So the level of acetaldehyde will be high in the body. And I told you all the unpleasant side effects, they start coming. और जब भी वो this alcohol वाला person after has a craving and he consumes even a little bit of alcohol, he'll have all these unpleasant side effects, because acetaldehyde won't get metabolized into acetic acid. So he will not like the idea of having alcohol. This is how we'll decrease this. Okay? So it inhibits the aldehyde. But already जो बना हुआ है, मतलब जो aldehyde convert हो जाती है acetic acid में, it can't do anything to that. It just will prevent. So make sure that for this, that no consumption, it will take some time. So no consumption of alcohol 12 hours prior. ठीक है? No consumption of alcohol 12 hours prior. So otherwise it won't be effective. ठीक है. Then you have to be cautious. जो उसके side effects हैं, it is hepatotoxic. So in liver disease or in patients of diabetes mellitus, we have to be very careful when you're prescribing this drug. So disulfiram is another drug which can decrease the craving. Then there are certain miscellaneous drugs like topiramate. It is also वैसे an anti-epileptic, but it also decreases craving. ठीक है? Then ondansetron. Ondansetron is a 5-HT3 antagonist. It's an antiemetic drug, but again it has been found to decrease the craving. Then we have lithium. It's a mood stabilizer, so it can stabilize the mood in such patients. So all these have been shown to decrease craving. So कौन सी drugs basically decrease करती हैं craving को? So we have naltrexone, we have acamprosate, and we have topiramate, ondansetron, lithium. Now disulfiram, see, as such, if you see here, one important thing, हम support therapy दे रहे हैं ताकि वो दोबारा he should not be consuming, पर वो craving को decrease नहीं कर रही है. It is just basically trying to antagonize the good effects or so-called good effects of alcohol. So it doesn't decrease the craving, it only helps in aversion, कि उसको नफरत हो जाए अल्कोहल से, वो उसलिए हम दे रहे हैं, बट क्रेविंग को ये डिक्रीज नहीं कर रही है. ठीक है. सो इसका सपोर्ट थेरेपी इज नॉट ओनली डिक्रीजिंग द क्रेविंग, सपोर्ट थेरेपी वुड बी जस्ट फॉर एवर्जन ऑल्सो. So disulfiram is for aversion, the rest of the drugs are going to decrease the craving. That's very important point to know. Then the other, after this we have done, now let's see another topic which is called as methyl alcohol poisoning. See, there is no dependence on this because patient don't consume this. It's not a very good thing to be consumed and they won't have a goody feeling, that's why. No, it's just poisoning. As I told you, spurious liquor किसी ने ले लिया and it has all side effects. So a patient will develop acidosis because of formic acid, retinal damage, very important इसका जो side effect होता है, so that can occur. So again the treatment would be, you just try to remove this from the body by gastric lavage, and then we have two options. See what happens here, if I go back to this diagram here, see methanol case में even this is a toxic agent and even this is a toxic agent. So where do you want to stop this metabolism? You would like to stop it right here. So you'd like to inhibit this particular enzyme so that formaldehyde भी ना बने और उसके आगे तो definitely नहीं बनेगा. So this is the difference between ethanol methanol treatment. Ethanol intoxication, जब हम ethanol की aversion create कर रहे हैं, उसका aversion सिर्फ एस्टेल्डिहाइड से होगा. अगर आप अल्कोहल डिहाइड्रोजनेज को ब्लॉक करोगे और या आगे चल, कोई फर्क नहीं पड़ेगा. ठीक है. सो methanol की poisoning में the important thing is that you have to stop formation of formaldehyde. This very step needs to be blocked. So the drugs which we are going to give are going to inhibit alcohol dehydrogenase, and those drugs, the first the drug of choice as such, अगर हम बात करें, fomepizole. It is an inhibitor of alcohol dehydrogenase. It's a very expensive drug, so हम जो सस्ता alternative ढूंढते हैं वो है ethanol. अब in patients में you try and give ethanol. Why are you giving ethanol? Because it has a very high affinity for alcohol dehydrogenase. अगर ये दोनों एक जगह पड़े होंगे, ethanol body में methanol भी है ethanol भी है, so जो alcohol dehydrogenase पहले किसके पास जाएगा? वो ethanol के पास जाएगा पहले. Ethanol is, it has a strong more connection with ethanol as compared to methanol. So इसकी bonding उससे ज़्यादा है alcohol dehydrogenase से. ठीक है. Because body के लिए ethanol ठीक है, body को पता है भाई मेरी connection ethanol से ज़्यादा है. Just to remember कि ethanol consume कर सकते हैं, तो alcohol dehydrogenase की जो connection है it is more with ethanol. So अगर methanol गलती से आता है तो वो उसको फिर भाव नहीं देता. अगर ethanol present है, अगर ethanol है ही नहीं तो वो उसी के पास जाएगा. पर अगर दोनों को फ्रेंड्स में इसको चूज करना पड़े, वो ethanol को चूज करेगा. और ethanol would be preferentially metabolized by alcohol dehydrogenase. So methanol metabolize ही नहीं होएगा, और methanol metabolize नहीं होगा तो formaldehyde will not be formed. It will not be formed, the toxicity will not occur. So There are two drug options. One you can give fomepizole, which is directly going to inhibit. The other you give ethanol, and that is going to act on the, or alcohol dehydrogenase is actually going to act more on the ethanol, and wo pathway for this is going to be decreased. This pathway is going to be decreased. So these are the two options for management of methyl alcohol poisoning. So gastric lavage, or you can give ethyl alcohol, or the third one is fomepizole. Then you can even give folic acid or folinic acid, because it helps in the conversion of formic acid to carbon dioxide. So it will allow it to dissociate. Then in case of बहुत heavy poisoning है, और supportively आप hemolysis भी कर सकते हैं, hemodialysis, not hemolysis, hemodialysis. उससे क्या होगा, फटाफट you will try to remove methanol from the body. The last one is ethylene glycol poisoning. Ethylene glycol poisoning. इसमें भी जो आपको चीज़ याद रखनी है, the treatment, it is similar to methanol poisoning. So here also you give fomepizole. नहीं है तो you can give ethyl alcohol. Then here pyridoxine is also effective. And for quick removal of ethylene glycol from body, you can give diuretics. You can do hemodialysis, because ultimately it gets converted into acid. So acid and acidic urine has a tendency to be reabsorbed back in the body. So what do? You make the urine alkaline. So when the alkaline urine बनती है तो वो acid को खींच लेगी अपने साथ, वापस reabsorption नहीं होगी. So this is to remove the poison quickly, right? So this is about the ethylene glycol poisoning. So this is all that you should know about the alcohols. Let's go back to what we've done today. We've done the three types of alcohol. Now this chart, this is very important. ठीक है, इसको inhibit करते हैं disulfiram. Because अगर आपको यही आता है ना सिर्फ, you can do most of the questions. So first alcohol dehydrogenase, then aldehyde dehydrogenase, alcohol, it gets converted to acetaldehyde, then formaldehyde, methanol बनता है ethylene glycol से glycolate. So aldehydes ही बनेंगे, ठीक है. और फिर aldehyde dehydrogenase aldehyde aldehydes पे act करेगा, it can form acetic acid, formic acid, oxalic acid. Acetic acid as such is inactive, there's no problem with this. But formic acid, oxalic acid, they are very, very problematic and toxic. So alcohol dehydrogenase को inhibit करने के लिए we have fomepizole. Ethanol, इन तीनों में से ethanol has the highest affinity for alcohol dehydrogenase. So अगर तीनों present है, so alcohol dehydrogenase जाएगा ethanol के पास, ठीक है. और aldehyde dehydrogenase को कौन से करती है, disulfiram. So there are certain other drugs which also have the same effect as disulfiram, इसलिए उसको हम कहते हैं disulfiram like action. तो जो important drugs जो ये करती हैं disulfiram like action, we have cephalosporin, cefoperazone, griseofulvin, chloropropamide, metronidazole. These are the other drugs which also are going to act by the similar mechanism of blocking the aldehyde dehydrogenase. So they have the same effects, that is and it is called as disulfiram like action. So they are all going to cause the accumulation of acetaldehyde, and जो भी side effects आएंगे they are because of accumulation of acetaldehyde. So acute alcohol intoxication में you will do symptomatic treatment lavage. Dependence में please remember what we have to do. We have to detoxify these are important to detoxify. Important that we have long acting benzodiazepine. We can use carbamazepine, or we can use beta blockers and clonidine. And to decrease craving or aversion, basically this is all to support the patient so that he doesn't go back to alcohol again. We can give naltrexone, we can give acamprosate, disulfiram, and other drugs like topiramate, ondansetron, and lithium. Now, To take care of methyl alcohol poisoning, the two important drugs are fomepizole. ये दो सबसे important है, ethyl alcohol, fomepizole. Fomepizole expensive है, इसलिए ethyl alcohol most of the settings में prefer करते हैं, पर जहाँ पे afford कर सकता है patient, then we give fomepizole. Ethylene glycol poisoning, again fomepizole and pyridoxine, and you can remove it quickly from the body by these procedures, right? So with this we come to the end of the chapter on alcohols. So just go through it, and I hope this makes a lot of sense to you. So see you in the next video. Till then, take care. Bye bye.